surgical center. I think it's in Louisiana, but I'm not sure. I know a physical therapist who was a world champion mountain biker, and she had that problem, and she had it repaired. It was very, very frayed, very, very limiting, painful to her. I've lost touch. I don't know the long-term end results. But another problem is sports hernias, in which it's not that tear of the ponerosis, the tendon of the oblique muscles, but rather, I think, a traumatic neuropathy here. And certainly some of those people do get debilitating pain. And why is it debilitating? Well, if you can image someone pinching your inguinal ligament, it's an exquisitely tender part of your anatomy. And think of that being pinched all day long. Second, every time you use your abdominal muscles, which is any time you're up and up, walking, sitting, turning in bed, you use those muscles so it pulls on that painful area. With respect to my own history, I also had a little table of bone removed here, and that's a common insult into the sensory branch of the inguinal nerve. And that was removed for a surgical procedure, and my symptoms definitely enhanced at that point. Within that same region, I had 2 episodes of violence. I kept my hands behind my back, and I tried to diffuse it with, typical assertive language, and I failed. And the hyperextension here truly enhanced the pain there. The motorcycle wreck involved, severe hyperflexion and extension of my whole body, neck and trunk. And my left hip went into hyperextension. I think it's miraculous that I did not dislocate that hip, but it truly stretched those nerves, and the blunt impact of hitting the gas tank was the provoking incident. So what I want to do now is go into some of the anatomy books, and this area is just not really well understood, and I had to work extremely hard to get a cursory understanding thereof. And I've spoken with some physicians, and after med school, they don't really remember this. They know how to do a hernia screen, but they don't really remember the intricacy of the anatomy. Now, some of this innervates the genital area, but in many people speak of the pudendal nerve, which is a sacral nerve that comes within the inside of the pelvis and innervates the same area. Well, there's a tremendous overlap with respect to the sensory function, and I'll show you that in the anatomy books, but that seems to be poorly understood. And I have seen tests on the internet that relate to seminars on topic, and the answer is always, what is the primary innervation of this area? And the correct answer is pudendal, as opposed to phrasing it as, what is the primary innervation of this area? Okay, pudendal, fine. What is the secondary innervation with perhaps considerable overlap of the external genitalia? And the correct answer to that would be, in fact, these nerves, which would be genitofemoral, genital portion of genitofemoral, ilioinguinal, and iliohypogastric. And I think that's a very, very important point, because diagnosis is everything. And if you're just treating one part of the nerve supply, if it's the only one involved, you're going to be fine. So a lot of pelvic floor specialists that are treating pudendal and balancing the pelvic structures and balancing the area where that nerve comes external and dives back in, blah, 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 very helpful. But for those who have a contribution from these other nerves that come from the upper part of the lumbar spine, we might be better serving the client if we address both areas. I'm going to show you in the anatomical text several pictures. In this pink is the inguinal canal, and the blue is the ilioinguinal nerve that you can see coming right out of that and descending down into the scrotal sac. And then again, ilioinguinal over here. And the blue ilioinguinal up here is a sensory branch. And then genitofemoral is in orange here, and genitofemoral coming down there, also innervating the a portion of the contents of the scrotum. And out here is a branch of the ilioinguinal, and up here is a branch which is actually part of the iliohypogastric. So, next photo, next picture. here's a nice view that shows you how, here's the T12 Intercostal Nerve. Okay, this is the front of the body. There's the belly button right there to orient you, and this would be the sternum up here covered. Here's the ribs. Okay, so here's your belly. All right, so up here in the green is iliohypogastric nerve, and then right below it is ilioinguinal. Well, many times these anastomoses, which means the two nerves are traveling and then they join up with each other. So that happens fairly frequently, and I think I need to read something. Embedded in the anterior wall of the sheath, just above the pubis, is the triangle pyramidalis muscle,